Hello, my name is Jessica Brown, and I'm presenting to you my capstone project discussing hemolyzed specimens. So first of all, let's discuss what is hemolysis. Hemolysis occurs when red blood cells are damaged during the collection process. This causes the red blood cells to rupture. If you look at the picture in the slide, you can see a normal um, specimen as compared to hemolyzed specimens in the middle and to the right of the picture. Hemolysis occurs more frequently in specimens obtained through intravenous catheters, accounting for 6 times higher rates of hemolysis as compared to traditional blood collection methods. There are several contributing factors that can increase the risk of hemolysis: site selection, collection process, the transportation route, as well as the evaluation of hemolysis. So first, let's look at site selection. Site selection is important as it can increase or decrease the risk of hemolysis. Hemolysis occurs in around 80% of specimens that are collected at distal sites. So the antecubital site, for instance, would be an ideal location for blood collection. However, it's the least ideal for inserting an IV catheter. Secondly, let's look at the collection process. So blood collection utilizing intravenous access increases the risk of hemolysis by 6 times. In addition, there are other factors in the collection process that can affect hemolysis. For example, not letting alcohol dry, not utilizing a needle that is too big, too vigorous mixing or inverting of the tubes, as well as leaving the tourniquet tool on too long. The next contributing factor could be the transportation route. Specimens can be either walked to the laboratory or they may be sent through a pressurized tube system, which is common in many healthcare settings. Pressurized tube systems can increase the risk for hemolysis as compared to transporting without the tube system. Therefore, if you have a lot of specimens that are sent through a tube system, that can increase your rates of hemolysis. And the research shows that the tube system increases the risk of shearing of the red blood cells, which then would create hemolysis. The last contributing factor is the evaluation of hemolysis. So hemolysis can be determined through a visual method, which is similar to the picture that you can see here, or can also be used through technology called a spectrophotometry, and that is determined as the best technique for measuring hemolysis. Before we review the data, I just wanted to talk with you about what really triggered the project and how this project kind of got started. So staff were coming to me with frustrations about having hemolyzed specimens. Patients were having to be redrawn. There were delays in care associated with the turnaround time for that specimen to be repeated. So I reached out to our safety and quality team to collect some data or to find the data to determine how many hemolyzed specimens have we had and have there been any trend issues over the last couple of years. So this data is retrospective data. It was collected utilizing the organization's safety reporting system, and the current process and also former process for that is a lab staff member will submit these reports with each specimen that's hemolyzed. So if you look at the data here, this snapshot shows you January 2017 through August of 2018. And you can see a significant increase. Although the data points are a little all over the place at times, you can see the trend increasing upwards with a significant increase from April to August. And this was a big frustrator for staff, not just staff in labor and delivery, but also staff in the lab, and also a dissatisfier for patients. Alamance Regional Medical Center, located in Burlington, North Carolina, was the site for this capstone project. Specifically, labor and delivery and the emergency departments were both identified as areas of having problems with hemolyzed specimens. For this project, we're going to focus on the Department of Labor and Delivery. This department does approximately 1,100 deliveries a year. They offer care for patients with low to high risk pregnancies, averaging about 100 deliveries a month. Their model of care provides services for triage, antenatal, labor, postpartum, and recovery patients. Using the 4 components that affect hemolysis, further examination of the process and products were conducted. All of blood bank specimens are collected when initiating an IV catheter in labor and delivery. The antecubital space is rarely used as this site the site is challenging for patients in labor in regards to position. The majority of specimens are transported via a pneumatic tube system, and once they arrive to the lab, hemolysis is assessed utilizing the visualization method. Hemolyzed specimens result in delays of patient care, inefficiencies for staff, poor use of resources, additional pain experienced by patients, and frustration for team members. The target audience for this project included staff from both labor and delivery and the lab. Labor and delivery staff account for 35 registered nurses, 5 surgical technicians, and 1 assistant director. Laboratory staff includes 6 blood bank technicians, 1 blood bank supervisor, 1 lab supervisor, and 1 director. In addition, of course, upper level nursing leadership is also involved. A literature review was conducted and found that hemolysis occurs frequently during the pre-analytical phase of testing. The pre-analytical phase of testing is the time before the specimen is processed by the lab. There's a PIVO collection device, which is an effective product for the prevention of hemolysis from the peripheral IV collection. In addition, there are inconsistencies with hemolysis analysis, and that's speaking to the visual versus the technology that's offered to assess hemolysis. And lastly, IV collection increases the risk of hemolysis, and that theme was seen throughout the literature. When trying to identify solutions for the problem of hemolyzed specimens, it's important to identify strategies that would be effective in increasing the rates of hemolysis. Lean methodologies encourage staff empowerment, continuous improvement, as well as the creation of a vision and sharing that vision with your team members. The suggested intervention for hemolyzed specimens is to utilize lean methodologies to engage and empower the team to decrease the number of hemolyzed specimens in labor and delivery. Lean methodologies were established by Toyota Manufacturing, and healthcare organizations adopted these principles to create a culture that encourages and expects continuous improvement and engages and empowers their team members. The idea behind lean principles is applied to problem solving for hemolyzed specimens. The intent is to empower frontline staff in identifying barriers and opportunities while also encouraging them to solve the problem. The nursing leader must create the vision and culture to encourage and coach this behavior. The American Nurses Association Scope and Standards of Practice provides nursing leaders with a foundation to apply to their everyday work. For the purpose of this project, there are many standards that apply, and we're going to review these now. So first of all, standard 1 is assessment. That is where the nursing administrator assesses the current situation, issue, or problem. They must collect data, recognize the importance of the assessment to the organization, also recognize the impact of attitudes and beliefs of team members, identify any barriers there are to data collection, and also have reliable evidence-based techniques for assessment. So in this project, As a nursing leader, I collected the data. I realized how important the data was to the organization for financial reasons, for staff satisfaction reasons, as well as patient satisfaction. Um, the team members were very engaged and are very engaged in solving this problem, so it's important to know that their attitudes about this are positive and they want to see change. And in regards to data collection, there were issues just with the process and how long the data collection may take, and also the fact that data collection occurs on the laboratory side and very rarely in the labor and delivery side. Standard 2 is also applied to this project in that there was a problem that was identified. So, as the nursing leader, I used the data collection to determine that there were trends, and we saw the data for hemolyzed specimens trend go up, specifically towards the latter part of the year. Standard 4, planning of the American Nurses Association Standards of Practice, is also applied for this project. The nursing administrator must develop a plan that identifies the problem, describes strategies and interventions to help solve the problem, and also develops outcome metrics to determine the plan's effectiveness. So, for the purpose of this project, um, we identified the problem of hemolyzed specimens. We determined our strategy for solving this problem, and that was utilizing lean methodologies. And we also developed outcome metrics to determine if the plan was effective, and that's utilizing the same tools that we used to identify the problem initially. Um, Throughout the planning of this process, the leader needs to make sure that the plan is created, that research is utilized, priorities are established, there's a timeline for the project. The leader must ensure that there's collaboration with the interdisciplinary team, creates a culture and a system that encourages continuous improvement, and also realizes that the plan must be adapted and changed based on the challenges and opportunities as well as barriers faced in the project. Standard 5A coordination is also utilized for this project. The nursing leader coordinates the implementation of the plan towards solving the problem. So, as the nursing leader, I've tried to be very transparent with all the team members, talking about the data, talking about where we are in the process, and making sure that they are informed. Um, and also to make sure that we have resources available to implement the plan. The next standard is Standard 6, which is evaluation. And so, as a leader, I need to be able to evaluate the current progress of the project and also determine if our goals and outcomes are being met. So, with that, we need to make sure that outcome metrics are established, that we're able to collaborate with others to evaluate our interventions. So, it's really important that labor and delivery and laboratory staff work together, and also that we're communicating with our team members, not just those that are involved in the problem solving or the committee meetings, but also the frontline staff who are working day in and day out to prevent this from occurring. Standards 9, communication, and 10, collaboration, were also important for the utilization of this project. Standard 9, communication, talks about the importance of the leader effectively communicating with their team members. That requires creating an environment that encourages information sharing throughout the process. There's effective communication from the leader to the staff, but also from the frontline staff to the leader. It also encourages conflict resolution. And I know with this project, there could be the impression of an us against them kind of mentality because labor and delivery staff may feel that the lab is, kind of punishing them by entering that data method. And also, labor and delivery staff feel that the lab is really not taking ownership or accountability in their role for decreasing hemolyzed specimens. But I think it's important as the leader to help communicate and also set relationships that are meaningful and that encourages staff members to work through those conflicts to really do what's best for the patient. So that also brings us to standard 10 collaboration, where the nursing leader must collaborate with team members to advance healthcare in the nursing practice. And I can't stress how important this relationship has been in, um, first of all, building the relationship with the lab, but also working together to problem solve with frontline nurses as well as frontline phlebotomists to help solve this problem. Standards 11 and 13 are the last that are applied for this capstone project. Standard 11 leadership is, I think, one of the overarching practice applications that are applied to the project. The nursing leader must guide within her practice setting, profession, and healthcare industry. So, as the nursing leader, I really try to create the vision and inspire the team to continuously identify ways that we can improve our practice. I also think it's very important that we create a positive work environment, a work environment where staff feels supported and feels that they are heard. It's also important to utilize practice standards and also evidence-based practice to ensure that we're providing the best care to our patients. And lastly, I think it's important that as a nursing leader that I participate in other interdisciplinary teams to help share my vision and experience with others. And then the last, Standard 13, evidence-based practice and research. I have found that this has been a really important part of this project in identifying strategies for reducing hemolyzed specimens, and also talking about some of the barriers that we may have as nurses for reducing hemolyzed specimens, especially since the hemolysis is measured in a lab, but a lot of the process occurs with labor and delivery nurses. So communication is important for any nursing leader, but it's specifically important in this project or anytime there is a project where you're trying to solve an issue affecting patient care and staff satisfaction. So there are three methods utilized for communication. The first is the interdisciplinary task force, and that is compiled of interdisciplinary team members with lab staff, labor and delivery, as well as a lean management coach that's helping us to develop our problem-solving strategies around hemolyzed specimens. The next way that we are communicating is through daily huddles. Daily huddles, and this is part of lean methodology, occur at the change of shift, and that's where staff are able to communicate different initiatives, barriers to the care that they're providing, any safety issues or concerns. And so this is a good way that we can get information out and real-time information. Finally, is through the use of unit-based councils. Unit-based councils meet monthly. In addition to the monthly meetings, there's also constituent lists that are utilized to disseminate information. And so that's like a communication tree where unit-based council representatives then reach out to their fellow colleagues to share any updates, unit updates, or issues that are going on. So any budgetary needs for the project at this point are very minimal. So with lean methodologies, you really want to examine the current process and find out how to streamline products and processes. So those things are really budget neutral strategies at this point. With lean methodology, there is the foundation of the issue itself, which is typically a really big issue, but there are also many problems that are underneath that. And so the phase of the project that we're currently in is really drilling down to determine what are those problems so we can really get to the root of each of those to help solve the overall issue of hemolyzed specimens. So in the event that all of those products and processes are streamlined, but there are still hemolyzed specimens that occur, the organization can look into the PIVO device, which is something we talked about in the literature review earlier in the presentation. and that there would be costs associated with this new product. So, as we've previously discussed, evaluation and determining outcome metrics is vital to the success of the project. So, in order to know how far you've come, you've got to know, first of all, where you started and then where you are in the process. So, utilizing the same data collection process as used in the initial um, collection of data through the safety reporting system is how data will be collected to determine the amount of hemolyzed specimens. And secondly, throughout the pilot phases of the project, daily collection will be occurring to determine if there's any changes. Um, for example, if we change products, if there's any changes in the number of hemolyzed specimens. Whenever taking on a project as big as this and that reaches out through multiple departments, it's really important to create a timeline to make sure that the team is staying on task. So the first step was to meet with the team to share the data and establish a plan. The next step was then to examine the current process and equipment that's being utilized. Following that step, there was a pilot that occurred over a week, and that's where the same equipment was utilized for blood collection. So the same tourniquet, the same IV kit, the same IV catheters, as well as the same vacutainers and tubing was used to determine if that made any difference in the amount of hemolysis. And then there will be a follow-up meeting to discuss what the findings were and what our next steps should be. Deuteronomy 31:6 states, "Be strong and courageous. Don't be afraid or terrified because of them, for the Lord your God goes with you. He will never leave you or forsake you." Leading through change is challenging and intimidating at times. Going against the norm and challenging others to change requires a leader to be strong and courageous. The Bible verse reminds me of the value of relying on the Lord for strength. Many times, leaders must make difficult decisions. However, leaning on God and praying for His guidance and understanding empowers leaders with strength and courage to face any challenge. So I know as I embarked on this project, I had some intimidation because I don't know a lot about the lab world and what all happens there. And here I am trying to go in and problem solve for both labor and delivery and the lab department. But I think having a humble approach and also approach that um, is focused on the patient and what's best for the patient has helped me to be courageous, and also, just praying for God's guidance and assistance when making those decisions, leading those teams, um, to be the best that I can be. And I think the curriculum here at Liberty University has allowed me the opportunity to see the value of the Christian worldview and of me as a Christian nursing leader to lean on God, lean on His Christian principles, lean on the Bible to guide my practice as a Christian and as a nursing leader serving my team. Please see the references on this slide and the next slide. I appreciate the opportunity to share my Capstone project with you and the experiences that I have learned through this project.